Hello everyone and greetings from Vardaan. Today we are going to discuss in this video about a very important topic is prenatal genetic testing. As a couple, when you go to obstetrician's office, or you must have heard from your friends and relatives as well that we should go for genetic testing. So in this video, we are going to talk about what is it, when should you do it, should you do it or should you not do it, and what are the types. So let us straight away dive into the topic and start the discussion. So, as the term says that prenatal genetic testing, that term clearly indicates that what is it? Prenatal means before birth. Genetic means related to genes and chromosomes. Testing means some of the tests which tell us that our upcoming baby is going to have any chromosomal or genetic disorder or not. So, that is about prenatal genetic testing. So, now the next question comes is when to do, who should do it. That means, is it applied for everybody who is going to become pregnant or who is pregnant, they should go for a prenatal genetic testing, or is it for some specific segments that this is the indication for doing the specific genetic testing. So nowadays we recommend screening tests for everybody so that at least the gross problems can be easily made out and the effective decisions can be taken. But otherwise, there are some specific indications. If you are having that, then definitely we must undergo prenatal genetic testing so that we know that our baby is having any problem or he is not having any genetic problem. So, what are those indications? Number one is there is a history of genetic defect in the family. Now, what do you mean by this? That means that in your family, either on the mother's side or on the father's side, do you have any history of anybody getting affected by a problem which is directly related to genes or chromosome? Now, what are these problems? These problems can be like thalassemia, hemophilias, can be some blood disorders, can be neural tube defects, can be brain problems, can be syndromic problems like Down syndrome, Edwards syndrome, can be some dysmorphic faces, can be some metabolic errors, can be something like cystic fibrosis or recurrent respiratory infections, some immunodeficiencies. So, if there is anybody in your family, be it is on either side, who has a definite genetic diagnosis and who was suffering from this genetic or chromosomal problem, we must disclose it to the obstetrician so that obstetrician will definitely make a note of it and recommend the prenatal genetic testing. Now, what is the second indication? Second indication is you are at a high risk of having a genetically affected child. Now, what is that? What does that mean? Certain factors put you at a higher risk, like age. If the mother or father is aging, mother's age more than 35 years, there is a definitely high risk of having problems like Down syndrome. So, definitely age more than 35 years or having some medical problems like diabetes, blood pressures, and all those things, they put you at little higher risk of having children with genetic mutations. So, we must again consider that prenatal genetic testing. Now, what is the third indication is carrier parents. If parents themselves, they know that they are carrying affected gene. So most of the times, like in some of the populations, the screening is a norm. Everybody gets screened. Like in Maldives, their screening for thalassemia is common. So everybody knows that I am the carrier, I am not the carrier and all. So if both the parents are carriers, there is a much higher chance that their child can be an affected child and will be having the disease. So in that case, that is a very strong indication of doing the prenatal genetic testing. Now, the second question comes, what are the types of prenatal diagnostic tests? So if you ask me, there are only two types of tests. One is screening test. The other is diagnostic test. Screening tests we apply to everybody, almost all. So screening test means basically they're applied to a larger populations where we straight away can pick up the big gross problems. So like ultrasound. Ultrasound we do in first trimester followed by second trimester, and we see that are there gross structural problems in the baby's body. So that is one of the screening tests. Second screening test is again mother's blood. From the blood test, we pick up some of the important hormones. And if those hormones are increased, that shows us that there is an increased chance of having problems like Down syndrome. So these are the screening tests which we usually do in the first trimester. And we pick up the people who are having higher risk of having structural malformations. So screening tests, they are not diagnostic. That we must understand. Screening test means only screening. Screening test will only tell you that you are having a high risk, you are having a standard risk, you are having a low risk of having a particular genetic problem. Now, after getting the results of screening tests, then we go for the diagnostic test. What are the diagnostic tests? They are almost completely like 99.9% diagnostic that you are having this problem or you are not having this problem. So in those cases, what do? We straight away take the fetal cells, the cells of the baby, we take it out either from the mother's blood or directly from the fetus. So if we take directly from the fetus, they are called invasive tests. If we are taking from the mother's blood and we are able to isolate the fetal cells, then it is a non-invasive test. So from these tests, we pick up the fetal cells and we check them for specific mutations. We do not check for all the mutations in the world. We just check for specific mutations which we are suspecting, where the family history is positive. And then those results we get it. And then after that, decisions are taken regarding whether we should bring this baby into this world or how effectively we should treat this child. So that is what is prenatal diagnostic testing. The next question comes that when should we do it? In the means, what is the exact time? So if you are looking for screening test, we should do it in first trimester. As soon as you confirm the pregnancy, usually around 6 to 8 weeks, we do an ultrasound, followed by another ultrasound in the second trimester, so that we grossly look at structural problems or nuchal fold thickness or any cardiac defects or any extra spots or shadows in the brain. So these are the things which we correlate, like we say that, okay, if it is there, then there is increased chance of having this particular problem, like that. If you ask me the diagnostic tests, again, diagnostic tests, if you are looking for invasive tests like chorionic villus biopsy, where we take a piece from the placental tissue, that is usually done between 9 to 13th week. Between 9 weeks to 13th week, we do that and we get the results within 1 or 2 weeks. And then if you are looking for amniocentesis, that means we are taking out the fluid from amniotic cavity, which is a cavity outside the fetus body. Fetus is wrapped into a cavity. Outside this, there is a fluid which is having the fetal cells. So that process is called amniocentesis. So if we are looking for amniocentesis, that is done beyond 15th week. So these are the timings when we do for the prenatal genetic testing. So this is what about prenatal genetic testing we wanted to tell in this video. In the next video, we are going to talk about these things in much more detail, how the things are done and all those things. If you like this video, you can share this video with your friends and relatives, and you can write your comments also. And please do write comments. What do you want to know in the next video, so that we can make the video on that particular aspect. Thank you, and subscribe to our channel and stay connected to us. Thank you.